Turkey tail mushroom, scientifically known as Traymetes versicolor, is a highly regarded polypore fungus distinguished by its vibrant, concentric color patterns that resemble the plumage of a turkey's tail. Esteemed in traditional Asian medicine for centuries, this mushroom is celebrated for its robust immune-boosting properties and potential anti-cancer effects. Recent scientific research has corroborated many of its traditional uses, positioning turkey tail as a valuable supplement in modern integrative healthcare. Growth and habitat. Traymetes versicolor is a saprophytic fungus widely distributed across temperate and subtropical regions worldwide. It thrives on dead or decaying hardwood trees, including oak, beech, and chestnut, playing a crucial role in forest ecosystems by decomposing wood and recycling nutrients. Turkey tail typically fruits in clusters on fallen logs, stumps, and tree bases, often persisting year-round in moist, shaded environments. Optimal growth conditions include high humidity and moderate temperatures, which facilitate its distinctive fruiting bodies. Identification. Turkey tail is easily identifiable by its fan-shaped, semicircular form, usually ranging from 2 to 8 centimeters in diameter. The upper surface showcases vibrant, multicolored concentric zones in hues of brown, tan, white, gray, and blue, creating a striking, layered appearance. Unlike gilled mushrooms, turkey tail features a porous underside, consisting of numerous tiny pores responsible for spore dispersal. The texture is typically leathery to tough, and the mushroom lacks a distinct stem, often appearing glossy when moist. Its persistent and overlapping growth habit aids in accurate identification. Edible uses. Turkey tail is not commonly consumed as a culinary mushroom due to its tough and leathery texture. Medicinal uses. Please note, this video is for educational purposes only and is not intended to diagnose, treat, or cure any ailment, illness, or disease. Turkey tail mushroom is lauded for its extensive range of therapeutic applications, supported by both traditional use and contemporary scientific studies. Key medicinal benefits include: regulates immune system, contains polysaccharopeptides, PSP and PSK, that modulate immune responses by enhancing the activity of natural killer cells, macrophages, and T cells, promoting a balanced and effective immune system. Prevents and treats cold and flu. Its immune-boosting and antiviral properties help prevent respiratory infections and reduce the severity and duration of colds and flu. Fights cancer. PSK and PSP compounds have demonstrated anti-cancer effects by inhibiting tumor growth, preventing metastasis, and inducing apoptosis in cancer cells. Supports cancer treatments. Acts as an adjunct therapy in chemotherapy and radiation, improving treatment efficacy, reducing side effects, and enhancing patients' quality of life. Treats HPV and cervical dysplasia. Enhances immune response against human papillomavirus, HPV, reducing viral load and mitigating cervical dysplasia, thereby lowering the risk of cervical cancer progression. Herpes and shingles. Exhibits antiviral activity against herpes simplex virus, helping to manage outbreaks of herpes and shingles by reducing symptom severity and frequency. Improves digestion and leaky gut. Promotes gut health by enhancing intestinal barrier function, reducing intestinal permeability, leaky gut, and supporting a balanced microbiome through its prebiotic fibers. Helps prevent and treat HIV/AIDS and Kaposi's sarcoma. Boosts immune function in individuals with HIV/AIDS, slowing disease progression and reducing opportunistic infections. Its anti-cancer properties also aid in managing Kaposi's sarcoma, a common cancer associated with HIV. Diabetes may aid in regulating blood sugar levels by improving insulin sensitivity and reducing insulin resistance, contributing to better diabetes management. Reducing inflammation. Possesses anti-inflammatory properties that help mitigate chronic inflammation, a common underlying factor in numerous diseases. Autoimmune diseases. Modulates immune responses, potentially benefiting conditions like rheumatoid arthritis and multiple sclerosis by reducing autoimmune activity without suppressing the immune system. Chronic inflammatory diseases. Supports conditions such as inflammatory bowel disease and psoriasis by reducing inflammatory markers and promoting tissue healing. Candida overgrowth exhibits antifungal properties that help control overgrowth of Candida albicans, restoring microbial balance in the body. Malaria preliminary studies suggest anti-malarial effects by inhibiting the growth of malaria-causing parasites. Chronic fatigue enhances energy levels and reduces symptoms of chronic fatigue syndrome through immune support and anti-inflammatory actions. Heart health promotes cardiovascular health by improving circulation, reducing oxidative stress, and supporting the integrity of blood vessels. Lowers cholesterol. May help lower LDL cholesterol levels, thereby reducing the risk of atherosclerosis and associated heart diseases. Lowers blood pressure. Its vasodilatory effects assist in reducing high blood pressure, contributing to overall cardiovascular function. How to harvest, season and location. Collect during the fruiting season, typically late spring to early autumn, in hardwood forests on dead or dying trees. Accurate identification. Verify key characteristics: fan shape, colorful concentric zones, small pores beneath, lack of stem, and tough, leathery texture. Sustainable harvesting practices. Harvest only a portion of the mushrooms in a given area to allow for regrowth. Drying and storage. Dry the mushrooms in a well-ventilated area away from direct sunlight or use a dehydrator. Store dried mushrooms in airtight containers in a cool, dark place to preserve their medicinal properties. Cautions. While turkey tail mushroom is generally considered safe for most individuals, the following precautions should be observed. Consult a physician. Always seek medical advice before starting any new supplement, especially for individuals with existing health conditions or those undergoing medical treatments. Correct identification. Misidentification with toxic mushrooms can lead to severe health consequences. Ensure accurate identification through reliable sources or consult a mycologist. Allergic reactions. Although rare, some individuals may experience allergic reactions. Discontinue use if adverse symptoms occur. Medication interactions. Turkey tail may interact with certain medications, particularly immunosuppressants and chemotherapy agents. Monitor and consult healthcare providers when combining treatments. Turkey tail mushroom, Trametes versicolor, stands as a potent natural remedy with a wide array of medicinal benefits. Responsible harvesting and mindful usage, combined with professional medical guidance, can unlock the full spectrum of benefits that turkey tail has to offer, making it a significant asset in holistic health and wellness practices.